Welcome. My name is Dr. Chris Montanaro. I am a board-certified chiropractor and a specialist in applied kinesiology. I specialize in treating people with difficult-to-treat conditions without the use of drugs and surgery. Today, we are going to talk about acid reflux. This is an abbreviated version of a much more detailed seminar. My goal is to arm you with an arsenal of information about your health and your body so that you can live a long, happy, and quality life. So let's get started. Evidence indicates that up to 36% of otherwise healthy Americans suffer from heartburn at least once per month, and that 7% experience heartburn as often as once per day. The incidence of GERD increases markedly after the age of 40, and it is not uncommon for patients experiencing symptoms to wait years before seeking medical treatment. So there are really three different gears that lead to acid production in the stomach. Don't worry about the names so much, but here they are in order of how they occur is acetylcholine, which is stimulated at the sight of foods, the smells, and the taste. Gastrin and histamine are both produced when you're swallowing your food and chewing your food, and histamine more so when your stomach starts stretching. There are a lot of different types of cells in the stomach, all working very hard to keep you healthy and to allow for proper digestion. Interestingly, the pH of your saliva is healthiest at about 7.4, and if you were to look at the pH of your stomach, it is around 0.8 just before the food leaves and moves into the small intestines. This is a logarithmic scale, meaning that from your mouth to your stomach, there is a 1,000,000-fold difference in acidity. Your body goes through tremendous effort to keep your stomach this acidic. We're going to consider two different trains of thought when you're dealing with acid reflux. The first group is the group that humans are smarter than the body. The job of the stomach is to be an acid-producing machine, and the group that thinks that humans are smarter than the body give acid-stopping medications to stop its normal functioning. And then group two are going to be looking at the fact that humans are not smarter than the body. The body is really smart, it knows what it's doing. This is going to be your more holistic alternative approach to acid reflux. A Group 2 thinking doctor sees that acid reflux is the result of slow digestion. Often these patients are constipated. Food sits in the stomach from a loss of the right kind of acids, and it rots and ferments and putrefies. Those are the acids that blow back up and cause a lot of pain. Instead, I would rather see the approach taken of speeding up digestion. If you speed up digestion, things are going to move on very quickly and you won't have to worry about it in the first place. Helping the body to produce more hydrochloric acid, digest food quickly, move it out of the stomach quickly, and then there's nothing to blow back up in the first place. So some important things to do are eating foods that are very rich in enzymes, fruits and vegetables, and not overcooking your foods. And don't dilute those good hydrochloric acids in your stomach with large amounts of fluid during your meals. Making sure that you get plenty of fiber to clean out the pipes, and there's also several possibilities of whole food supplements and herbs that can be very beneficial at any stage of acid reflux, but we can discuss those on a one-on-one basis. Gastroenterologists and other physicians treat GERD with antacids and acid-stopping medications such as Nexium, Prilosec, and Prevacid. Some of the common side effects of these drugs include headaches, diarrhea, abdominal pain, which is interesting because you're trying to get rid of some of that to begin with, and nausea, and of course many others. It is a scientific fact that in order to properly absorb minerals, you need a very acidic environment, which means that things like calcium are not getting absorbed properly. And this also then means that you can be led towards muscle cramps, insomnia, decreased immune system function, and decreased bone mineralization, and decreased healing capacity, especially from all the minerals that you're not getting. That highly acidic environment in your stomach is meant to be one of many protective barriers for you. If you were to eat foods with bacteria, for example, the acidity should kill the bacteria and protect you, but this won't happen optimally if you're taking acid-stopping medications, which does leave you open to possible infections. Now remember earlier when we talked about phase 3 of digestion, which is histamine, producing more hydrochloric acid in the stomach. What other medications are so many Americans on these days? They are taking antihistamines. And if you apply it here, since phase 3 digestion is histamine, they are really taking antidigestives. Remember, when you eat and the stomach is stretching, your nose may start to run a little. This is a completely normal response and is the result of phase 3 digestion. Interestingly, there are several studies which indicate that allergies and asthma are directly related to low hydrochloric acid levels in the stomach. Part of the problem with these medications is that they are putting a piece of duct tape over the check engine light. You cover up some of the symptoms and it fixes nothing. Theoretically, you are being prescribed these meds for the rest of your life. If they were actually fixing something, you would take them, they'd be fixed relatively quickly, and then not need them anymore. So again, they are not fixing anything. There are several approaches to helping your body digest better and make you healthier. Each person is an individual though, and it is not the same for everyone, which is why I would like to offer you a special gift to come into the office for a free history and consultation. I believe your health is too important, so I'm offering this gift at no charge. Please take advantage of it. Visit my website and fill out the contact information on it, or call the office to come in for your free consultation. I hope you enjoyed this information. You can certainly check out all of the other mini seminars I have online covering a large variety of health problems. And if you don't live in the central New York area, still visit my website for information, and you will find links to doctors in your area who understand these holistic concepts and who will be able to serve you best. I can also provide phone consultations. Thank you again, and I will look forward to seeing each one of you and being a part of your health team.